Okay, this is Dr. Ezi, and we are still discussing the abdominal aortic aneurysm, and it's a critical care station in the MRCS Part B. Okay, so we finished 4 questions, and actually there may be some confusion in this station, and you want to know that. Okay, so they ask you about the complication of hypothermia, right? So they may ask you about the consequences of hypothermia. Okay, and they may ask you about the physiologic or metabolic consequences or complications. So there is no problem. Actually, if you mention them all together, you will take all the marks. There will be no problem. But we want to add some here to the complications which we have taken in systems. Okay. And we want to add, for example, for the metabolic, we want to add the hypocalcemia also is a complication. Okay, this is some. We mentioned hyperglycemia. We mentioned metabolic acidosis. You want to add this to them. Okay, and we mentioned hypoxia also. Okay, so all these are mentioned in the complications already. So if he asks you about physiological complications. If he asks you about physiological complications, okay, he have taken this, he told complications by systems or physiological complications, you want to take the metabolic complications mainly, including the platelet dysfunction also, and including the complications of acidosis in general, and complications of hypoxia and complications of hypothermia. So all these are related together. Anyway, no problem. You can mention them in any way you want, but tell the information to the examiner. Okay, it is written there. If it is compatible with what it is written in front of him, you will get the mark. Okay, so let us take this part, which is about the consequences. They may ask you about the consequences. Let us call it question 5. That is 1-5 for the physiological. Let's say it's 6. Consequences of hypothermia. Consequences of hypothermia, and the consequences are things that will happen after the issue has finished. Okay, so first of all, this patient, number 1, will be very difficult to wake up from anesthesia. He will wake up with difficulty. Okay, and if he wakes up, he will be in a very bad discomfort because of the low oxygen that was what occurred before, and the low temperature and the poor enzyme function and all these things. Okay, number 3, you want to know that this patient will have very high surgical bleeding because his platelets are not working, right? Okay. And in addition to that, you want to know that this patient may develop MI or arrhythmias, and this actually is said repeatedly here. Okay, that MI, because this is the most common complication of hypothermia is MI and arrhythmias. Okay. This patient will have, we mentioned discomfort because of the sympathetic stimulation on walking and these things. So this patient will have a negative protein or negative nitrogen, balance, and this is because he will break protein in this situation here. Okay, so he will have impaired immunity because of the poor enzyme of the function. Okay, and because of this, he will be susceptible to develop wound infection. Okay, so these are some of the consequences of having preoperative or intraoperative hypothermia. So that the core temperature dropped at a time to a very low level. Okay, well, so to this point here, they are going to ask you the next question, and the next question is the last question in this part in hypothermia. How can you reduce the risk of hypothermia, or how can you treat hypothermia? Both are the same question. So in this point here, you are going to tell the examiner that I'm going to follow the NICE guidelines. NICE guidelines, okay? This is the correct answer. You are going to follow the NICE guidelines. So what are you going to do, or how will you follow the NICE guidelines? First of all, I'm going to keep the temperature of the theater at 21 in the theater, okay? Not less than that. 21 to 24, but not less than 21, okay? You want to increase pressure and humidity of the air in the theater, okay? I want to increase the humidity of the anesthesia gases, okay, because they are so cold. Fine. I want to I want to warm the IV fluids. I want to warm the blood. Okay, all these are NICE guidelines that will prevent the hypothermia. Okay, I want to reduce the patient exposure. If either the body exposure or the visceral exposure, okay, if you can. So in the visceral, you want to cover the organs with plastic or something, okay? Body you will cover also with sheets, heavy sheets that will not allow him to lose temperature, okay? And what can you do more to that? Okay, you want to body temperature, you are going to use some blankets or something like that, okay? You want to also keep the patient and at the recovery room, okay, at the recovery room until temperature is at least more than 36 or more, okay? His temperature is 36 or more. You will not send to the ward until his temperature is like that, okay? And the last resort, if his temperature did not get back to the normal, you are going to use something called bed hangers. And bed hangers are some sort of blankets that is filled with warm air or hot air, okay? Okay, this is some appliance that will help you to raise the temperature of the patient, okay? They may ask you another question, and they may ask you, how do the patient lose heat? What is the mechanism? This is the 7th question here, okay? They may add it to another question, they may ask it in separate, and they may ask you, what is the mechanism? Or what is the factors that will lead to patient intraoperatively to lose temperature? You told before he was bleeding and so on. He had cold IV fluids. He had cold blood. This before. So what is the mechanism or factors that work in this issue? Hypothermia develops. So first of all, you are going to use some physics here from an old concept. You know that temperature or heat is transferred by 3 ways. It's transferred by conduction, it is transferred by convection, okay, convection, and it is transferred by radiation. And you want to mention that the temperature in this case here in hypothermia mostly is transferred by radiation. He loses temperature by radiation. So he loses mostly temperature from the viscera by evaporation, which is a sort of radiation, right? So this is a very big factor here, radiation. Fine, this is the first part. Then after that, you are going to mention the other factors that we have mentioned before. So the cold anesthetic gases, so you are going to tell the other factors, okay, after this. So the examiner will understand that you know what you are saying. So I'm going to tell about the anesthetic factors, gases, you are going to tell about that the patient cannot shiver, no shivering, Okay, so because patient is paralyzed with the muscle relaxants, and you are going to tell the other things that you told before, that cold IV fluid, cold everything, cold gases, cold IV fluids, cold blood, and all these things. Emergency surgery is a very important factor here, and this is why the things are not warm before, the fluids and the bloods and these things. Patient is shocked. If he is a child, he will be more prone to the hypothermia, and on this way you are going to include everything. So this is a question that may be asked. You want to know additional things about the how to answer it. Okay, so until this part, hypothermia has finished. I will meet you in the next session, the third session in this point, and we are going to talk about blood transfusion now.